Hi, welcome to Doc Talk. Doc Talk is the podcast put out by the Knoxville Academy of Medicine, which talks about health issues affecting all East Tennesseans in plain language. So glad that you could join us today. I'm Elise Denneny, former past president of the Knoxville Academy of Medicine, and I am very, very privileged to welcome today Senator Richard Briggs, Dr. Richard Briggs, retired Colonel Richard Briggs, friend Richard Briggs.
That's the most important and the most meaningful.
What we would like to talk about today, with your permission, is you've been working on the opioid problem in East Tennessee for 10 years, longer, both as a physician, as a legislator, and as a community member. You see all aspects of it. So just tell us your thoughts on it.
Well, if we look at the problems that our state is facing, I think there's just really no question that the opiate crisis is the most important that we're facing. And it's more than just personal tragedy with the opiate crisis where someone's addicted to drugs and it affects their family. That's very, very personal. But it extends way beyond that. Right now, we're pretty much in a full employment economy in Tennessee, which is very, very fortunate. We have the lowest unemployment rate our state's ever had. We also have a very favorable business environment, and so companies and manufacturers are wanting to come to our state to build their factories, hire our workers. But the problem they're running into is that they can't find people to work because too many people are testing for drugs, testing positive for drugs. And we have to address the problem from that standpoint, which is beyond the personal tragedies. Also, we know that we have many women who are addicted to drugs, who are childbearing age, who are having children that are born addicted to drugs. And really the epicenter of the country is the Knoxville Children's Hospital. We have people coming from all over the world to learn how to manage the little babies that are addicted to drugs. And we can get them through it. It's very expensive. They can spend a long time in the ICU being detoxified from the drugs that happened while they were still in utero. But what we're now finding out is that the problem doesn't end there. They're becoming school-aged, and we're finding out that they now have both behavioral problems and learning disabilities. And these are learning disabilities that the special education teachers are telling us don't respond to their normal techniques for learning. So we've got a whole population, and it's getting more and more every year because the number of children born are increasing, and so we haven't been able to flatten the curve on that. If one other part I was going to add, we all are concerned about personal security. Our sheriff used to say that 95% of property crime was related to drugs. Today he's saying it's almost 100%. So it doesn't matter if we have family members, it doesn't matter if we're in business, just in the security that we have in our own homes and in our own cars are affected by this crisis.
Yeah, I think you touched on something so important. If anybody, any Tennessean feels like, oh, this doesn't matter to me, they're wrong.
It matters to all of us.
Yeah, in some way or another, because the loss in commerce, the loss in revenue, the loss in contribution as an individual citizen of East Tennessee, and then obviously security, like you mentioned. I find it really interesting what they call neonatal abstinence syndrome, or NAS, which really is a big, long word to say that babies born to moms who are dependent on a substance then also are dependent on that same substance.
That's correct.
Yeah, and it's preventable. Mm-hmm. Jackie, she'll get mad at me for saying this, but she helps and takes care of a child who has NAS. And she said, Mom, he was slow to walk, he was slow to talk, he couldn't keep his food down. It was 24/7 because he didn't sleep the normal even 2 hours that a baby sleeps. I can't even imagine being a single mom and trying to take care of one of these children.
You just wonder how they manage sometimes. And you know, there's another aspect, because it's not only people like Jackie that's doing it, but when these moms are addicted to drugs, frequently the children are taken away from them. And they may even have other children that aren't addicted that could be normal, and they either have to go into foster care or what we call kin care, kinship care, which is grandma, grandpa. We have legislation this year that's trying to address that problem, but the Department of Children's Services in the state of Tennessee has asked for an additional $78 million in their budget over last year, because there's over 1,000 more children this year going into foster care than there was the previous year, and it's all related to the opiate epidemic. And what's even more sad is that Tennessee has 77,000 children that are being taken care of by grandparents who are over the age of 65, and they do not receive any assistance from the state. It's not like foster care, where there's it's about $900 per child in foster care per month. But when they go in,
and they're living off Social Security.
that is the big issue. You may have grandma who's trying to live off $700 or $800 of Social Security that now may have 2 of her grandchildren that she's taking care of. She can get the kids on TennCare. She may be eligible for food stamps, but that's it. There's no other state aid available to her.
And she can't hold a job.
And she can't. No one. She can't take a job. She's
Right.
First of all, she's older. She's over 65. But we're trying to do something to address that. But there's just so many. The cost is just going into outer space.
I'm glad you bring that up. What's so interesting to me is that it is preventable. I think that no woman becomes pregnant and thinks, I want to have a child like that. I know there just isn't. And a lot of them don't realize that even receiving treatment for substance use addiction, sometimes the treatment for that also has that same risk.
Well, it does. And we know that the recidivism rate for the treatment for the drugs are very high. It's very expensive. The U.S. Department of Mental Health and Drug Addiction feels that you have to have almost 90 days of inpatient therapy, and then you'll need lifelong support afterwards. And that's part of what we're running into and trying to address the people that are already addicted. How do we get them off the drugs? And that's a very expensive proposition. We did not expand Medicaid in the state of Tennessee, and Governor Haslam last year in this year's budget put $21 million into the drug problem, but not all of that's going to be going to rehab, and quite frankly, it's just a drop in the ocean trying to address what it's going to cost to get some of the addicts off the drugs.
I'm sure it's hard for commercial payers to cover that cost also.
Well, that's fine to talk about the commercial payers, but the truth is that most drug addicts don't have insurance, and this is a burden on the hospitals where they're coming in with all the problems they have. I'm a cardiac surgeon. When we finish filming this today, I've got to go see a consultation of an IV drug user who has an infected tricuspid valve. Right here in Knoxville, our group of heart surgeons, have done over 120 heart operations on drug addicts that have infected heart valves. And to put that in perspective, many of our viewers are aware of Massachusetts General Hospital, New England Journal of Medicine published their big series over 5 years of 12 cases. We've got 10 times that down here. I mean, literally 10 times that we have documented that we're trying to deal with.
How often do we have, you fix a valve and then it becomes infected also?
We have some data on that, and it's about 80% of the people go back to drugs. And that's one of the reasons we started the study, is saying, is it really a good use of resources if we spend all of this money, which by the time you do the heart surgery, which is very expensive, the hospitalization, you can't send a drug addict out with a PICC line or an IV line to come into an outpatient infusion center, because they're just going to shoot drugs up to it. So we usually have to keep them in the hospital for about 6 weeks to receive the full course of antibiotic therapy. So this gets really expensive. I mean, it's over $100,000 per case, and we know that close to 80% of them are going to be back on drugs if they can't get some sort of therapy.
They really do need those wraparound services that everybody.
Yeah, they need the wraparound services, but again, so many of them don't have insurance.
Right.
Because they're not able to hold jobs. And another little factor in there that gets very expensive is I personally have never operated on an IV drug user that has an infected heart valve that wasn't positive for hepatitis C. So if we're going to treat that, it's another $60,000 to $80,000 on top of what we've used to take care of him already if we're going to address the hepatitis C problem.
So you mentioned that you had some video that you had that was talking about a lockable.
Yeah, what it is this isn't the silver bullet, but we know that 90% of drug addicts started taking drugs as teenagers, and the first drugs they used were prescription drugs that they took from either their friends or family.
Okay.
And we're trying to stop the diversion in the home medicine cabinet. I have a bill that would require the pharmacies to offer a lockable valve, a lockable pill bottle to people when they come in. They can opt out if they don't want to, but they at least have to be made aware that it's there. We're not trying to, someone say, well, they can go out there and break it open with a sledgehammer and axe. Well, yeah, but you know the kids have been in the bottle if they do that. But what we don't know is the pilfering of 2 or 3 pills that wouldn't otherwise be missed. And this is trying to stop that pilfering. This is where the drug addiction begins. It's at the home in the medicine cabinet.
I had a funny story. The person, let's see, I need to make sure I get it correctly, but it was a neighbor, and the neighbor's son had a substance use disorder, and the neighbor's son would come to the house as a friend and go into their medicine cabinet for getting their dog's pain medication, and would take it out and then substitute something that looked the same for the dog. So the person never actually knew that they were missing medication. The dog wasn't getting the right medication.
Yeah.
And the neighbor was getting free drugs.
Well, this is like I said, this is a huge problem. 90% of our addicts started as teenagers pilfering pills from the family medicine cabinet.
All right. There's also recyclable programs out there that help to use, I know that as the medical community, we're getting much better at trying to identify exactly how many opioids that you might need after surgery or for whatever reason, and then not to give in excess.
Well, this is no longer a medical decision. This has been put in the Tennessee Code. Last year we passed a bill that I say many of us are suffering under because I actually opposed to it. I thought the bill was too strict. It only applied to opiate naive patients, after surgery or after an injury. If you're a chronic opiate user, it didn't apply to you, and if you're someone who has terminal disease, it didn't apply to you. But what it did, it put restrictions on how many pills you could give. And we're actually, I voted against the amendments. I thought they were too strict. As a heart surgeon, I know how to make you hurt. And I didn't think that the amount of opiates that we could prescribe would be adequate to cover a person's postoperative pain. We only use them short term. And these laws were even stricter than what we've been using for a long time. I do know that they're bringing some bills back this year to liberalize that some, because pain pills aren't just to stop pain. I would rather have my patient take the pills, get up, walk around, avoid getting a DVT, coughing, keeping the lungs clear, not getting pneumonia, and recovering quicker than I would just lie in bed holding still, where they may have a manageable amount of pain, but they can have those complications of DVTs and pneumonias.
You kind of tick 2 boxes right there all at once, and that's what's so great about you, because you can discern a real big Gordian knot into something smaller. But the legislature is just not agile enough to do medical management.
I'll tell you, the legislature does not need to be practicing medicine.
That's right.
Going back, we could talk about why do we have an opioid epidemic to begin with? There's so much blame to pass around. It all started back in the early 90s when the idea that you shouldn't have any pain after surgery, or if you have pain, we've got a pill for it. Everyone knows that OxyContin became available in 1995 or 96, at least those of us who are more mature doctors. And it was billed as a non-addicting pain control medicine that was the magic pill, the magic silver bullet that we've been looking for generations. Non-addicting. It was very, very heavily marketed by the Purdue company. The federal government got in on it where, pain, we hear it every day. How much pain are you having on a scale of 1 to 10? That all got back to the opiates. There were posters put up in the hospital, posters put up in VA hospitals that pain is the 5th vital sign. We've heard that. The JCO, the Joint Commission of Accreditation of Hospitals, would come and they would sanction hospitals because we weren't writing for enough pain medicines. The state of Tennessee in 2001 passed a law called the Intractable Pain Act. It said if you go to your family practitioner and you want to get narcotics for pain, by law, if he did not want to prescribe them, by law he had to refer you to a pain clinic. And now we're just realizing the folly of all of that. And the legislature doesn't need to be practicing medicine, and this is where I think they've gone beyond where they should, even on this part with the opiates. We do have a crisis, and we do need to do something about it, but the legislature doesn't need to be trying to legislate something that they don't understand.
It just moves so fast, and it really truly is so complicated. So any final recommendations on, well, obviously to the community about how to address the opioid crisis? I think what we didn't touch on was that if you know somebody who has a substance use disorder, talk about it, help them. It's not something that you shove underneath the rug, and there's nothing to be ashamed of.
This is not something that just affects families. We have as we have our own physicians that develop a problem. Right. Usually they do after a very serious illness. And what they try to do, they think they can handle it themselves. They don't want to ask for help. And it doesn't matter if you're a physician, if you're a wealthy businessman, or whatever. When you have this opiate addiction problem, it's not something you're going to be able to fix yourself. It's something that you're going to have to need to get help on.
And we're here to help them. So thank you again, Dr. Richard Briggs, for joining us to just talk briefly about the opioid epidemic that's facing East Tennessee. So thank you for joining us, and that's a wrap.